Hello all of you. Today I am discussing the radiograph of the chest. This is the chest x-ray. First of all, we should know about the view. The view of the x-ray is posterior anterior view. And I also have one more same x-ray, but that view is anterior posterior view. Let me show that. So this is the anterior posterior view and this one is posterior anterior view. I will tell you how to differentiate, but before that I am telling you that whenever we see the chest x-ray, most of the time these type of the x-rays are posterior anterior view. Posterior anterior view. And there are some more x-rays in the body, for example the paranasal air sinuses. For the paranasal air sinuses, we used to see with the posterior anterior view. In the posterior anterior view, we pass the rays from the back side of the body and the film or the plate is placed on the anterior side of the body. The posterior anterior view. And after that, we have to identify the hard part and soft part that we can see in this x-ray. So the thing is, there are two things. The one is the radiolucent and the other is radiopaque. The radiolucent means the thing that you can see the black plaque. The all black colored area means this. The shadow of the lung. This blackish part. This is the shadow of the lung. And above we can see some air in the trachea. This is the part where the trachea is present and there is some air. So this part is radiolucent. So all the black colored area is the radiolucent and this whitish area. We can see the shadow of the rib. This is whitish as compared to that black colored area. This is radiopaque. And there are some more structures we can see the radiopaque, but it depends like what is the density of the air and water in these areas. So according to that we can see some light whitish or the dark whitish. In this x-ray, what we can identify, we can see the shadow of the ribs. These are the ribs. And in between the ribs we can see there are the lungs, the grey colored part. This is the trachea. In the trachea we can see the air. Because this is the posterior anterior view, we can't see the vertebral column clearly. But here in this part, the shadow of the trachea is covered by the cervical vertebrae. That's why we cannot see the clear part of the trachea. More down we can see the mediastinum. In the mediastinum, it is occupied by the vessels of the heart, like the ascending aorta, arch of the aorta. More down we can see the shadow of the heart. This is the shadow of the heart. This is the left ventricle of the heart, the shadow. And here the noted things are the aortic knuckle. We should know about the aortic knuckle. So you can see this part. Here we can note a depression. This is the aortic knuckle. What happens over here? Here. The arch of aorta turns to the left side at this part. So a notch is formed over this area. This is called aortic knuckle. Over this area. This is the aortic knuckle. More down we can see this is the cardiac notch. So this lung is left lung and this is the right lung. Right lung, left lung. This is the posterior anterior view. In the posterior anterior view we can note the shadow of the ribs. We can see the lungs. These are the ribs, and this black area is the shadow for the lung. This is the right lung, this is left lung. This is your aortic knuckle. This is cardiac notch. This is complete shadow of the heart. And here this point. This here. This is the costodiaphragmatic angle. Costodiaphragmatic angle. And here we can find a recess that is called costodiaphragmatic recess. So this is the posterior anterior view. Moreover, we can also identify the clavicle. This is the clavicle, the shadow of the scapula, the shadow of the humerus, scapula, clavicle, ribs. I already told you the aortic knuckle and the cardiac notch. One more thing, the hilum of the lung. In the hilum of the lung, we know that there are bronchial vessels, pulmonary vessels, and lymph nodes are present. So this area, you can see the white appearance in this area. This area is called hilar region. hilar region. In the hilar region, we can find out the lymph node and the vessels. This area. This is the hilar region. Now I am moving to the anterior-posterior view. So how to differentiate between the anterior-posterior view with the posterior-anterior view? The first thing is, in the anterior-posterior view, the film is placed on the posterior side and the rays we are passing from the anterior side. In the anterior-posterior view, we can easily identify the vertebral column. You can see the vertebral column in the anterior-posterior view. But in the posterior-anterior view, we were not able to easily identify the vertebral column. Moreover, we can easily identify the scapula. The boundaries of the scapula are more prominent, but you can easily identify the vertebral column. So if we can see the vertebral column, it means this is the vertebral column. This is the anterior-posterior view. And also we can note the shadow of the ribs, shadow of the lung, the black colored area, and the shadow of the diaphragm. This is the shadow of the diaphragm. Now, why we are taking the anterior-posterior view? If the patient is not able to stand in front of the X-ray film, means in the patient patient is on the bed or in the supine position or dealing with some kind of the problem, that time we are taking the anterior-posterior view for the chest X-ray. And otherwise, for most of the time, we are taking posterior-anterior view. This is the posterior-anterior view. Again, repeating the things. Air in the trachea, mediastinum, the shadow of the heart, the left ventricle, the cardiac notch, the ribs, lung, aortic knuckle, cardiac notch. So these are the parts that you should know for the chest X-ray, and also the hilar region or hilar region, you can say, for the hilum of the lung. This white dots representing the hilum region. This is the anterior-posterior view. We can see the vertebral column in this. And this X-ray is taken from a patient in the supine position who was on the bed. Thank you.